by this term analgesics? Painkillers. Or we say that those drugs which are used to treat the pain, they are called as an analgesics. Okay? Don't talk, please don't talk. Then what do you mean by opioid analgesics? We know that opioid basically is a term used for those drugs that are obtained from the plant named opium poppy. Okay? For example, you heard about the morphine. You heard about the morphine. So there is a difference between the opioid analgesics and the analgesics. As we just discussed, that analgesics, they are those drugs. Can you hear me? Analgesics are those drugs which are used to treat the pain. Okay, but sometimes the pain is so severe. For example, we have an organ-related pain, kidney pain, or during the delivery of the baby. We use those opioid analgesics. Okay, so those pain which are the deep-seated pain or not superficial pain and which are not controlled by the other analgesic, we use the opioid analgesic. What is the difference between these analgesic and opioid analgesic? These analgesics, they are the all the voice coming inside. Okay, so what's the difference between the analgesic and the opioid analgesic? That these analgesics, they are the weaker analgesic, while opioid analgesic, they are the stronger, as we just discussed, that we use for those pain which are not controlled by the analgesics. Another important point is that these opioid analgesics, they act on the central nervous system, while those other analgesics, they don't act the central nervous system. That's why you see some of the opioid analgesics, they are used as a part of the anesthesia, general anesthesia also, okay, because they make the patient sleep also, okay. There are strong rules and regulation for using the opioid analgesics. Even if you go to the hospital, you have only few consultants. They are authorized to prescribe these opioid analgesics. Okay? You cannot get those opioid analgesics from outside pharmacy. Only you can get it from the hospital pharmacy. And as I told you that they have the specimen signature of those consultants in the pharmacy. Whenever they receive the prescription, they need to match those signatures with their signature. And if there is any alteration, they refuse to give this one. Even if someone wants to grow the plant of the opium poppy, they have to be, take permission from the government, and there are very strong rules and regulations. Even in the hospital also, when any inpatient receive any morphine or any other opioid, the nurses, they are not allowed to throw the empty ampule. That empty ampule, along with the record of the patient, with the medical record number of the patient, how much dose was administered, and at what time, how many times in a day, that will be attached to that one and sent to the government authorities. So why there are so strong rules and regulations, why there are so strong protocols? Because the main problem with this drug is the drug abuse or the drug addiction. Okay? So there are too many cases in the hospitals also. If you see, I saw in my country also and in other countries also. Even sometimes the hospital staff, if they use this overdose, I remember one of the guy, he actually was working in the OR, and he was addicted with these drugs. And one time he received that drug, and when he went home, he told his wife that I'm going to take the bath, and he went for the bath, and after 30 minutes, when he didn't came, our wife, just broke in the door, and he found that he was dead in the bathtub. The reason they found that there was a drug overdose, opioid overdose. We saw how many times there was a famous cricketer. Maybe I think you know about cricket. Yeah. There was a famous Australian famous cricketer. He was on vacation in Malaysia or something. He died, in the night because of the drug overdose. Okay? So that's why, because of these problems, there are very strong rules and regulations from the government authority just to avoid those drug abuse. You got my point? Okay? There is a procedure which is called as a narcotic exchange procedure. What happens if someone, if any ward in the patient, they need a medication for the patient. So there is a procedure, as I told you, narcotic exchange that occur between the pharmacist and the nurses, and there are specific times. Only that time, the nurses, they can take those morphine or any other medication for the patients. Is it clear? Okay. So let's start with this opioid analgesic. We have 2 lectures. So inshallah we will finish this topic by tomorrow. Let's see what are the objectives which we have to cover by the end of this topic. So number 1, we will be discussing about the major classes of the analgesic, that is an opioid analgesic versus the non-opioid analgesic, such as we discussed about the NSAIDs, which stand for the non-steroidal anti-inflammatory drug. We have this topic of NSAID, we will discuss later on. The second one, we will be discussing about the mechanism of action of opioid versus non-opioid analgesic. The third one, we will be discussing about the classes of the opioid drugs and their receptor. The fourth objective, we will be discussing about the different opioid agents and their indications. There are many indications of the opioid. Some of the opioid we discuss apart from the pain, they also have therapeutic uses. You will see sometimes in some cough syrup also they have this small amount of the opioid also. So we will discuss about the indication, and then we will discuss about the side effects and the contraindication of the opioid drug. Okay? So these are the objectives which we have to cover by the end of this topic. As we discussed that these analgesics, they are categorized into 3 categories. We have an opioid analgesic, then we have a non-opioid analgesics. Example, we have an NSAID, and then we have the third category, which are called as an adjuvant. Now what I mean to say adjuvant are those drugs whose primary effect is different, but they use as an analgesic as a secondary effect. Okay? So non-opioid, that is non-narcotic, NSAID, their analgesic activity is relatively weak. Then we have an opioid, and then we have adjuvants, which are the diverse group of the drug whose analgesic effect is secondary to their primary effects. We have some general anesthetic medication. They basically used as an analgesia, but their secondary effect also, they have some of these that they act as an analgesic also. Like we have an opioid, their primary effect is an analgesic, but some of the opioid they use as a part of the general anesthesia because they make the patient unconscious. Okay, so these are the categories of the drugs. Then, according to the WHO analgesic ladder, when you go to the hospital, whenever you have a pain, they will tell you how you rate your pain. They ask sometimes this question from 0 to 10, how will you rate your pain? If you have a 1, that means a little pain. If you have a 10, that means a more pain. So according to the WHO analgesic ladder, we have step 1, where we can use, if the pain is not very severe, we use the non-opioid plus minus adjuvant analgesic. Step 2, where we use opioid for mild to moderate pain, then plus minus non-opioid or plus minus adjuvant analgesic, and then the third, we use opioid for moderate to severe pain, plus minus non-opioid and the adjuvant analgesic. What I mean to say plus minus, whenever we need it, we add that one. Okay. So these are about the analgesic. Then opioids, we discussed that these are the natural or the synthetic compounds that produce the morphine-like effect. The term opioids is reserved for the drug such as morphine and codeine, which is obtained from the juice of opium pepper. Some of the opioids, they are the natural, and they can obtain from the plant opium poppy, that is we have morphine and the codeine. But the rest of the opioid, they are either the semi-synthetic or synthetic opioid. Okay, what I mean to say semi-synthetic, that is you can obtain as a natural source and you can further modify in the lab. And some they are prepared as a synthetic. So we have morphine and opium, morphine and codeine, and then the rest of the opioid, they are either the synthetic or the semi-synthetic preparations of the opioids. The opioid or the narcotic analgesic, along with the NSAIDs, they are the main agents which are used to control the pain. And however, all narcotic analgesic, they have a liability of drug abuse physical dependence, and the addiction. This is the main problem. Drug abuse, physical dependence, and the addiction. That's why whatever I mentioned to you in the beginning, that we have a very strong rules and regulation in order to manage those opioids. Okay. Why this problem? We have physical dependence and addiction because we discussed that these drugs act on the central nervous system. Therefore, all narcotic and analgesic, they are called as a controlled substance. Okay, we have not only the opioids, but we have some other drugs also which are considered as a controlled substance. Some anti-epileptic drugs, and we have some other drugs which are considered as a controlled substances. What I mean to say controlled, that they are not easily available, and you have only few consultants. Even if you go to the hospital, we have assistant consultant, we have physician, staff physician, they all are not authorized to prescribe all these controlled substances. Only the consultant, the full consultant, they are authorized to prescribe. Then we discussed about the opioids. We have a morphine and codeine, which are obtained from the juice of the opium poppy. The analgesic action of the codeine derived from its conversion to morphine by the site P450-2D6 enzyme system. If you remember, I told you in the beginning about cytochrome P450. We discussed that it is one of the family of the enzyme. It is not a single enzyme, it's a family of the enzymes. So this is site 450-2D6 enzyme system. It's one of the family of the cytochrome P450, whereas the drugs antitussive effects are due to the codeine itself. And if you see the morphine, their analgesic action because of the conversion by the enzymes, where they are antitussive. Antitussive, we use a word that is for using the cough. Okay, when we use for the treatment of the cough, we use the term that is called as an antitussive. Tussive is a cough and anti is an against. Okay, so as I told you that some of the cough syrup, they also have this codeine. Okay, that's why if you took that cough syrup, you basically patient feel sleepy. But that actually is not a controlled substance. Why? Because you just put the codeine in a very small amount in the cough syrup. Okay, so this is about the morphine and the codeine. Then we have some endogenous opioid peptides that is present internally. They are relieved from the nerve ending, and then they modulate the transmission in the brain and the spinal cord. So we have as we discussed that sometimes we have a natural opioids or synthetic opioids, or we have a semi-synthetic opioids. So apart from morphine and the codeine, all other opioids are prepared from either morphine, that is semi-synthetic opioids such as heroin, which is a semi-synthetic preparation of the morphine, or they are the synthesized from the precursor compound such as the fentanyl. Fentanyl again is a very good drug frequently used by in the hospital as a painkiller. Okay, so these are about the opioids. Then what are about the endogenous opioid peptide? We have three main endogenous opioid peptide. Number one, we have an endorphins. Number second, we have an enkephalins, and number third, we have an dynorphins. Their release, the point of release is from the different location. For example, if you see about the endorphins, their primary peptide is the beta endorphin, which is found in the hypothalamus and other brain nuclei in the anterior pituitary, and released in response to the stress. Sometimes you see, if you have a pain, sometimes if you just walk or you feel that or the pain that automatically release. Why? Because of those release of the endogenous opioid peptides. So that's why you will feel that those pain is automatically relieved. Then we have an enkephalin, widely distributed in the central nervous system and interneurons, especially those mediating the pain pathways. And then we have a dynorphins, widely distributed in the central nervous system, associated with the spinal cord mediated pain pathway. So these are the three natural endogenous opioids which are released from different parts of the brain. We have endorphins, enkephalins, and the dynorphins. Then about the opioid receptor, Basically, opioid interacts with the protein receptor on the membrane of the certain cells in the CNS, on the nerve terminals, in the periphery, and the gastrointestinal tract. We discussed about last time also about the receptors, that every drug has its own receptors, and these receptors, they are the biological targets for the drug. If you see about the opioid receptor, we have three main types of the opioid receptor. We have a mu receptor, we have a kappa receptor, and then we have a delta receptor, and then recently we have one more new opioid receptor, which is called as ORL1. But as far as the analgesic activity of these opioids is concerned, the main analgesic activity of these opioids are because of the mu receptors. So mu receptors are the main receptor for as far as the analgesic activity is concerned. Then we have other receptor we discussed about the kappa, delta, and the ORL1. Then each receptor family exhibits a different specificity for the drug it binds. I will show you some of the examples that some of these opioids, in some cases, they act as an agonist, while in other cases, they act as an antagonist also. So we discussed that sometimes the drugs act as a both. If you remember, we discussed the example of the epinephrine and the acetylcholine in case of pharmacodynamics and kinetics. So these analgesic properties of the opioid are primarily mediated by the mu receptor. How these drugs will work: binding of the opioid to their receptor, they inhibit the calcium channels and open the potassium channels. As a result of this, inhibiting the calcium and opening the potassium channels, there is a net result is decrease in the release of some pain mediators such as dopamine, serotonin, and substance P, which result in the blockage of the transmission. So the main purpose when we give the opioid is to block the release of those pain mediators. We discussed like serotonin, dopamine, and the substance P. So in this way, these opioids will work. Okay. So this is the mechanism. Then we discussed about the classification of opioid analgesic and antagonist. So I told you some of these opioids they act as an agonist, and in some cases they also act as an antagonist. So we classify as strong agonist. If you remember, we used the term full agonist and partial agonist before. Okay. So we say strong agonist, also called as a full agonist. We have morphine, fentanyl, meperidine, methadone, hydrocodone, and hydromorphone. These are the drugs which are classified as a strong agonist. Then we have a moderate agonist. The example we have in codeine. Then we have a mixed agonist and antagonist. That is, as I told you, in some cases they act as an agonist, and in other cases they act as an antagonist. We have buprenorphine, pentazocine, and nalbuphine, and then we have an antagonist, pure antagonist. And these are the drugs which are used to control the toxic effects of the morphine and the other drug. We have naloxone, naltrexone, and the nalmefene. All three are the antagonists, but depending upon their half-life and depending upon their duration of action, we use. So you will find frequently naloxone is one of the antagonists which is frequently used by the hospital. The main problem with the opioid, if someone has an overdose, is the respiratory depression. Okay, that they inhibit the respiratory centers. So this is a main issue. So that's why we use these antagonists to reverse the effects of the morphine and the other drugs.
Yes, the highlight. Also, there was the highlight before. This is just
highlight actually I forgot, right? Because these are the drugs we added this year. Okay, because in the latest edition we found these drugs, so we added this edition. We forgot actually to remove this one. I don't know, when I was uploading there was nothing showing, but I don't know how somehow when we upload so it produces a yellow color. So yellow color does not mean anything that these are important or not. All are important. Those which are not important I already mentioned during my lecture. For example, I told you about the percentages in medication safety. We don't ask about any specific percentages. Or in alternative medicine there was some graph. Again there was a percentage showing. So I will not ask those percentages. And in medication safety also, showed you some examples of the look-alike and the sound-alike drugs. Okay, so that also just for your understanding. Okay, but highlight, I repeat, does not mean that this is important and the others are not important. As I told you, highlight actually we added those drugs this year, so that's why because we updated lectures every year, so we added those drugs this year. Okay. So this is about the opioid classification. I think I'll stop here. Inshallah, we'll continue this tomorrow. I'll just give you 5 minutes if you have any questions. So that